Workplace injuries happen. Most happen fast. How you respond and how soon after the incident can determine a victim's chances for recovery or even save their life. Responding to an accident might evoke your fight or flight response. First aid requires a much different mindset. Being informed and practicing first aid ahead of an event is the only way to truly be prepared to help a victim. Are you ready to administer first aid? Can you quickly locate a first aid kit and related equipment at your workplace or job site? Do you know the steps to administering first aid for burns, cuts, choking, and other emergencies? While it's true that some first aid is basic and won't require additional medical assistance, you must also be prepared to provide potentially life-saving first aid to give victims their best chance at survival while waiting for emergency medical help to arrive. This training will orient you to the major categories of risk and types of first aid, give you an overview of the supplies and equipment involved, including guidance on preparing your own first aid kit, will help you know what to do before choosing to administer first aid, and walks you through some of the steps for performing first aid for common injuries and illnesses. We will also explore what to do if you find yourself without a kit but needing to administer first aid, the legal considerations involved in emergency care, and next steps you can take to better prepare yourself and others to administer first aid. Keep in mind as we go through this training, first aid is no replacement for safety protocol. The proper sequence of protection in the workplace is first to purposely follow safe practices, then rely on any personal protective equipment you may be wearing as a second line of defense. And finally, be ready to administer first aid and call emergency personnel when needed. According to U.S. Bureau of Labor Statistics historical data, nearly 3 million non-fatal workplace injuries and illnesses are reported by private industry employers each year. The majority of these cases are in the healthcare and social assistance industries. The manufacturing, retail trade, transportation and warehousing, accommodation and food services, and construction industries represent a large portion of the other incidents. More than a third of these resulted in at least one day away from work. Moreover, thousands of workers die each year from workplace-related incidents, with most occurring in the construction trades. OSHA considers first aid to include the cleaning of minor cuts, scrapes, and scratches, treating minor burns and blisters, application of bandages, administering non-prescription medicines, removing debris from eyes, massage, and relief of heat stress through fluids. OSHA's record-keeping rule does not require these basic forms of non-emergency first aid to be reported. The injuries, illnesses, and fatalities referenced previously were reported incidents, and so were likely more severe than basic first aid could address without requiring additional medical attention or advice. Although first aid may have been attempted in these more serious reported cases, you can infer that first aid is more widely administered than any statistic will ever capture. In other words, workers are injured every day. Timely and properly administered first aid may be the deciding factor on recovery time, post-injury disability, or victim survival. Even what appears to be a minor injury, if left untreated, could lead to grave results. Every workplace and job task comes with its own set of risks. Exposure to temperature or pressure extremes, chemicals, being entrapped or enveloped by material or equipment, falls, slips, and trips, transportation incidents, and even becoming a victim of workplace violence are all potential sources of injury or illness. Each person has their own individual level of risk for certain hazards as well. A person's body mass index, for instance, might be a predictor of how well they hold up to heat exposure and their risk of sudden cardiac arrest. In this training, we will focus on injuries and illness, along with their common signs and symptoms related to open wounds, burns and abrasions, temperature extremes, musculoskeletal injuries, eye injuries, mouth injuries, bites and stings, breathing problems and choking, cardiac events, and unconsciousness. There are additional life-threatening emergency situations to consider, so this scope is not all-inclusive. When in doubt, call 911 and administer first aid as appropriate. Take a moment to consider your own work environment. What risks are involved? Are you working in or near temperature extremes? Do you work with moving parts or material debris? Does your work involve electrical systems where electrocution is a potential hazard? Regardless of your work situation, there are always health hazards present. Keep in mind that policies and safe work practices are your first line of defense against injury and illness. This includes having access to emergency phone numbers and procedural texts. Preparation is key to properly and promptly administering first aid. Many injuries require the use of medical supplies for treatment. Every employee should know how to quickly locate an appropriately equipped first aid kit and other emergency supplies and equipment, such as a fire blanket, emergency shower, or appropriately rated fire extinguisher. A first aid kit located on a construction site or production floor might look very different from one in a classroom or office building. The International Safety Equipment Association has laid out minimum performance requirements for first aid kits in various work environments. These requirements cover types, quantities, and sizes of supplies based on workplace characteristics. Standard kits are designed to treat the most common workplace injuries, such as minor wounds, cuts and abrasions, minor burns, and eye injuries. These kits should include adhesive, triangular, and roller bandages, including burn dressings, sterile pads, trauma pads, and eye coverings, adhesive tape, antibiotic and antiseptic products, burn treatment gels or sprays, cold packs, hand sanitizer, medical exam gloves, eye and skin wash, scissors, and also a first aid guide. Some kits will also come equipped with tweezers, breathing barriers, thermometers, and similar tools, or even a splint and a tourniquet for more severe injuries. It is up to employers to decide the quantity and breadth of supplemental supplies and equipment with which to outfit and augment first aid kits. This can be informed by incidental reports and industry safety profiles, along with input from employees on existing health conditions and workplace safety concerns. For instance, knowing an employee is at heightened risk of experiencing a cardiac event might prompt your first aid provider to include aspirin in your kits and set up an automated external defibrillator unit. Kit inventories should be periodically reassessed for relevance and expiration dates. Expired supplies should be discarded and replaced. In some work environments, your place of work changes. This is true of service workers who make site visits, transportation industry workers who travel constantly, construction workers going from one job site to another, and employees working in agricultural areas where you may be a great distance from your central work location. In circumstances such as these, the work truck or other everyday means of equipment storage and transportation becomes your first aid kit location. Caution must be taken, however, to keep these kits from exposure to the elements and temperature extremes, including sunlight exposure for prolonged periods. Some kits are designed especially with portability in mind. Also important for these circumstances is to always know where medical facilities are located and how to contact emergency personnel. Particularly important for construction and industrial personnel, you should always know where the water supply is located. Be sure you have immediate access to it in the event of an emergency. Often outside hose bibs require a special key to operate. Obtain this key and have it readily available before starting work. Everyone on the job site should know where the key is located and also how to communicate with the site's facility workers if available. Do you know where your first aid supplies are? Locate them and check them for suitability and expiration dates. Prompt first aid response to emergencies often makes the difference with the workplace injury or illness outcome. However, this aid also must be appropriate to the situation. This means a first aid provider must first assess the situation before administering aid. Remember that this training is focused on emergency treatment of open wounds, burns, and abrasions, temperature extremes, musculoskeletal injuries, eye injuries, mouth injuries, bites and stings, breathing problems and choking, cardiac events, and unconsciousness. Depending on the severity of the injury and the victim's history or temperament, they might very well be exhibiting signs of stress or even panic. How you approach someone in need of aid plays a crucial role in how long it takes to administer first aid and how well you can perform it. Obtaining the victim's attention, consent, and cooperation are important steps. Take care, this could get messy. Take every effort to not be injured or fall ill yourself in the process of attempting to help someone else. If the injury or illness is a result of extreme temperatures, confined spaces, poisonous gases, or similar situations where entering without appropriate protective gear would harm you, first stop and call for assistance. It will do neither you nor the victim any good if you both wind up in the same situation. Minor injuries, such as small cuts, bites and stings, minor burns and abrasions, and the like, can be easily identified and communicated from the victim. Note that a bite can be from an animal or from a human, and that diseases can pass from host to victim through this process. Also, stings affect some people more so than others, based on allergic or fear reactions. Communication is just as important in first aid as it is in any workplace operation. You may not know if a minor injury requires immediate professional medical attention if proper communication does not take place early on. Consider more serious conditions, such as heat stroke or choking. A victim of heat stroke may be severely disoriented and uncooperative. Someone who is choking will likely be clutching their throat, which is a common indicator of this condition. Other signs include gasping, wheezing, the face changing color, especially blue, a panic look, typically accompanied by an inability to speak or make noise, gagging, or frantic waving of the arms. When a person appears to be choking, attempt to first make eye contact with them and clutch your own throat gently while asking, "Are you choking?" in a clear voice. If you ascertain that they are indeed choking, you should ask, "May I help you?" It's possible they are already in a state where they cannot give consent, but this is an important step in also calming the victim down and informing them of your intent to perform first aid. Similarly, a person with an eye injury is likely communicating this by covering their eye. A person with a back sprain or other musculoskeletal concern tends to cradle or favor those areas. Take the few seconds required to make observations of an injury before attempting first aid. In the case of distress caused by an internal injury or other stressor, ask the person if they take medication for their symptoms. An example would be if they have a heart condition or are prone to seizures. For more serious conditions where communication is impossible, such as severe cardiac events or unconsciousness, first call 911. You should still assess the situation and perform a head-to-toe check for injuries of the victim. Assess the victim's responsiveness. Check for airway blockages and breathing. Check their circulation and look for any medical alert tags, bands, bracelets, or other indicators. When a victim is unconscious, consent to administer first aid is implied. Ideally, not only would every employee be prepared to administer first aid, but each workplace would also have a designated first aid provider. In fact, OSHA requires trained first aid providers to be on site, regardless of how large or small the organization, if there are no nearby suitable medical facilities available to treat employees who could become injured. Once you have determined first aid is required, and you have quickly but thoroughly assessed the situation, alerting emergency personnel if necessary, you can begin administering care if it is safe to do so. Keep in mind that whenever possible, even if you are waiting for emergency medical professionals to arrive, you should not leave the victim and should continuously monitor them. This is especially important for victims who are or may become unconscious. If you do determine that you cannot administer any additional care, providing them appropriate shelter, comfort, and helping them stay calm or conscious will still be beneficial and potentially life-saving actions. When major injuries or illness demand calling 911, always let the victim know that help is on the way. This can be done prior to receiving their consent to first aid and reinforced as appropriate. We will now deep dive into treatment methods for the minor and major injuries and illnesses, and also related physical states that are part of this training. It is assumed for each of these treatments that the first aid provider will wash their hands, wear gloves, and take other precautions to protect both themselves and the victim from the spread of infectious disease. As a general rule, always consider whether the treatment you are going to administer will improve the victim's condition or worsen it. Do not continue with care that will cause greater harm or bring them closer to death. In all of these scenarios, do not move the victim unless it is necessary for their continued safety. If there are multiple victims on the scene, prioritize care based on severity and likelihood of death. The primary goal of first aid is to save lives, and there is no perfect formula for making judgment calls in severe emergencies. Generally speaking, you will prioritize non-breathing victims first, followed by unconsciousness, head injuries, bleeding, broken bones, and burns. Each scenario differs in severity, and the best preparation is continuous practice and training. Cuts and lacerations are extremely common workplace injuries. Impalements are also common and can range from simple splinters to being stabbed by projecting objects. The first goal is to stop the bleeding. For minor cuts and scrapes, bleeding often stops on its own. When bleeding does not stop quickly, applying gentle pressure with a clean bandage and elevating the wounded area will slow down or stop the flow. Once bleeding has stopped, rinse the wound with clean water. It is best to avoid applying cleansers to the inside of a wound. Once cleansed, pat the area dry and cover appropriately. You can add a healing and antibacterial ointment as well. For a splinter or smaller embedded material, such as gravel, unused or sanitized tweezers should be used to first remove the foreign material as thoroughly as is possible. For serious impalements, it is safer to keep the object in to avoid bleedouts while waiting for emergency medical personnel to arrive. The victim might try to remove the object themselves, but should be told not to. Elevating the wounded area and applying pressure around, but not directly on, the embedded object are still appropriate practices. To help stop bleeding, clean bandages may be wadded up near the point of impalement. With amputations and other serious lacerations, first aid is again being administered while awaiting the arrival of emergency medical personnel. Attempt to stop the bleeding through the use of tourniquets and bandages. Do not place amputated body parts directly on ice, but do keep them in cold environments. Wrap them carefully to avoid direct contact with ice. If a wound is deep or has gaping or jagged edges, stitches would be needed, which is well beyond the scope of first aid. This is also true of any injury where bleeding will not stop or is gushing out. For all serious injuries such as impalements and amputations, be on the lookout for the victim going into shock or cardiac arrest. Another common and typically less serious scenario is a nosebleed. Someone experiencing a nosebleed should sit down and remain still. Pinch the lower portion of their nose gently but firmly. This is the part of the nose that does not feel bony. The victim may be able to do this on their own. Keep this pressure going for at least 15 minutes. Contrary to popular belief, people experiencing a nosebleed should not lean their head backward, as this might cause blood to flow into the throat and induce vomiting. They should instead lean their head forward and continue breathing through their mouth. Once bleeding has stopped, a cold compress may be applied to constrict the affected blood vessels. The victim can then stand upright and should be monitored to make sure the bleeding has stopped. If they are lightheaded, help them stay steady or sit upright to avoid further injury. In some cases, nosebleeds can be a sign of a more serious condition, so ongoing monitoring of the victim's status should be completed to determine if additional medical help is required. If the nosebleed is the result of an injury, the victim should seek follow-up care. For minor burns or abrasions, run cool water over the affected area for several minutes. Cold compresses may also be applied. However, applying ice directly to skin could cause more harm to the affected area. If pain relievers are available, administer these as directed on the package. Some antibiotic ointments also have pain-relieving properties. Antibiotic cream or burn treatment gel or spray should be applied gently, followed by clean gauze. Do not wrap the gauze too tightly. If blisters have formed, they should be kept intact unless they are extremely painful. If a blister bursts, treat it as you would any other open wound. Do not remove the parts of the blister. Clean it, apply antibiotic cream, and cover appropriately. Very painful blisters can be drained, but the blister should first be swabbed with iodine. Then, using a sharp needle that has been cleaned in rubbing alcohol, the blister can be pierced near the edge. Use caution not to induce bleeding from pinpricks. Appropriate barrier ointments, bandages, and protective gauze may then be applied. A common mistake when treating burns, cuts, and abrasions is rubbing. Never rub the affected area. Call 911 for serious burns that cannot be treated simply through first aid. This would generally involve large areas, but always when there is charred flesh. While waiting for help to arrive, apply a cool, moist bandage to the affected area. Never immerse a body part in cold water, as this could induce shock. Although distressing, non-emergency musculoskeletal injuries occur often. These include simple strains and sprains, like a twisted ankle or a pulled back. In these cases, have the victim rest and relax that area. Assess whether first aid is appropriate and recommend a visit to their physician for follow-up if needed. Ice packs, heat packs, and support braces are often helpful. For minor musculoskeletal injuries such as these, follow the RICE acronym: rest, ice, compression, and elevation. More serious injuries include fractures and breaks. Bruising or even disorientation may also be signs of internal bleeding and contusions. Mental or other behavioral changes, particularly ones that seem beyond the victim's control, can be indications of shock, head injury, or spinal injury. Broken bones, severe pain, numbness, and the inability to use a limb correctly are other examples of serious problems. These are beyond basic first aid treatment, but administer what help you can. Never try to set a fractured or broken bone. Have the victim stay still to avoid further injury and provide for their comfort and safety while waiting for help to arrive. Eyes require particularly delicate treatment. Absolutely never rub an eye injury. Imagine if a speck of metal or other abrasive or sharp object were causing the injury or irritation. For minor conditions, blinking and the use of eye drops will help the victim's eye naturally remove the irritant. It is best to simply flush the eye whenever possible. Never remove objects that embed in eyes. Instead, use an eye shield wrapped with a bandage from your first aid kit and seek medical attention. For chemicals in the eyes, keep the victim's eyes open and call for professional help while locating the water source to begin continuous eye flushing. Mouth injuries may involve broken teeth or jawbone, along with bitten cheeks, tongue, or lips. This can cause significant bleeding and swelling. That, along with a threat of loose teeth and tissue clogging airways, can lead to difficulty breathing and a choking event. The first step is to check breathing and clear any blockages. Then bleeding should be controlled. This is best done while the patient is in a sitting or half-sitting position and by applying pressure to the tooth socket or wound. The same precautions should be taken as with other wounds, with consideration for ongoing monitoring and care to avoid swallowing foreign objects, checking for allergic reactions, and mutual protection against infection. Eye and mouth injuries, beyond the simplest of irritation and trauma, will require follow-up consultation of a medical professional. Bites from small animals and stings from insects might not seem like cause for concern. However, animals and insects carry disease such as rabies and other illnesses. Moreover, many people suffer from allergic reactions to stings. Some animals are venomous. In fact, if you live in an area with a large population of venomous snakes, spiders, scorpions, or other creatures, having the appropriate anti-venom on hand in your first aid kit is worth considering. Bites from humans and bigger animals tend to manifest as larger wounds. For non-allergic reactions, treat a bite wound as you would a laceration. Wash the area with soap and water, followed by antibiotic ointments and a proper bandage sequence. In all bite cases, it is prudent to follow up with a physician to review the proper treatment for potential infection transmission from both animals and humans. Closely related to allergic reactions are respiratory issues. Anaphylaxis can occur as an allergic reaction that drives the body into shock, often causing airways to close up and restrict or completely cut off breathing. A victim experiencing an allergic reaction should be kept calm and asked if they have an allergy emergency pen. If you do not know how to administer an allergy emergency pen, you can often obtain practice pens and instructions from a pharmacist. It is best to have them lie down on their back with their feet elevated a foot off the ground. Do not give them anything to eat or drink, and do not administer medicine to them. Remove anything that might restrict their breathing, including loosening tight-fitting clothing. Once an allergy emergency pen has been administered, emergency medical personnel should be called. Choking is another very common occurrence where prompt action can dramatically change the outcome for a victim. The classic Heimlich maneuver involves standing behind the victim. Lean them forward slightly with your arms around their waist and fist clenched. Grab your fist with your opposite hand and place these between their navel and rib cage. The maneuver is completed by pulling your clenched fist sharply back and up under the rib cage in several quick thrusts. For very large individuals or someone who is pregnant, this maneuver should instead be completed around the chest and not the stomach. Back blows are another common method of dislodging objects from the air passage. This is particularly useful for victims who have become unconscious and can only be set on their knees. During these attempts, if possible, look at a bystander directly and firmly order them to call 911. If you are unable to dislodge the object after initial attempts and emergency help has not been called, take the time to make the call. Have a sense for how long it has been since the choking began. If you yourself are choking and no one is able to assist you, leaning up against the edge of a table, chair, workbench, truck bed, or similar surface and thrusting against it may be your best chance at dislodging the object on your own. Heart attacks or other cardiac events are also common. Chest pain is a typical warning sign of a cardiac event, along with pain in other parts of the upper body, shortness of breath, nausea, cold sweats, and lightheadedness. Signs of a heart attack may vary based on gender or other physical characteristics. At times, cardiac events can be mistaken for heartburn, indigestion, or even soreness of the neck, jaw, or arms. If you witness a cardiac event underway and can communicate with the victim, ask if they have medications they take for their heart, such as nitroglycerin. If so, help them take the proper dose. For adult victims who are alert and experiencing mild chest pain that is likely caused by heart trouble, and who also do not have a known allergy or physician's order against aspirin, they may chew and swallow an appropriate dose. However, since a call to 911 will have been made early on, the decision to administer aspirin, and in what dose, can be made over the phone with the emergency response worker. As with anaphylaxis, difficulty breathing during a heart attack or other cardiac event can be partially alleviated through loosening of clothing around the victim's neck and torso. Cardiac arrest and other heart-related traumas are common side effects of electrocution. Breathing may also stop due to muscle spasms or paralysis. Electrical burns are also extremely common. It is important to remember that electrical hazards must first be disconnected before engaging a victim, in order to avoid becoming a victim yourself. cardiopulmonary resuscitation, known as CPR, should be started if a heart attack victim has lost consciousness. CPR and rescue breathing are not within the scope of this training. However, if you work in an environment with heightened risk factors related to cardiac events, it is recommended you seek out specific training on administering CPR and also AED device use. When an injury or illness, such as those experienced during prolonged heat stress, is extensive enough, a victim may go into shock or suffer a stroke. Sometimes, emotional extremes may also cause a person to go into shock. Shock and strokes of all types are life-threatening, so any care you provide will be done after calling 911 and awaiting the arrival of medical personnel. Signs of shock include cold, clammy skin, paleness, nausea, sometimes accompanied by vomiting, shallow breathing, chills, and confusion. Elevating the victim's legs, providing them with hydrating fluids if their injury safely permits it, and covering them to keep them warm are appropriate interventions. The treatment for hypothermia also includes covering the victim after gentle removal of any wet clothing. It might be readily apparent based on the situation that a victim is likely suffering from hypothermia, but common symptoms include trouble speaking, confusion, and poor coordination. They should be elevated off of cold surfaces and out of cold environments if possible, but all movements should be controlled to avoid sending them into cardiac arrest. Warm, hydrating fluids can be provided to conscious victims, along with the application of warm, dry compresses to only the neck, chest, or groin areas. Direct heat should be avoided to prevent damage to the skin or sending them into shock. Frostbite is a related condition where treatment involves removal from the cold environment, followed by giving the affected area time to soak in water that is at or a few degrees above normal body temperature, or for small areas, skin-to-skin contact. As always, the area should not be rubbed. Soaking should be given time, about 25 minutes, and dry heat should be avoided. Very gently placing clean cloth wads or cotton balls between fingers or toes after they have been warmed and then loosely wrapping these extremities will also help. On the opposite temperature extreme is a heat stroke. Heat stroke is the most dangerous heat-related illness. A person experiencing heat stroke will exhibit signs of confusion or disorientation. As with a typical stroke, slurred speech and seizures are common symptoms. Since the body has reached a point where it can no longer self-regulate, body temperature rises dramatically. The skin often becomes hot and dry, and the victim may even lose consciousness. Covering a person experiencing heat stroke is not advised. Instead, they should be carefully moved to a cool area and provided with hydrating fluids if they are conscious. When the situation safely allows for it, having the victim partially submerged in a cool tub of water or taking a cold shower is preferable. A sponge bath, fan, cool mist, damp cloths, and other sources of cool water are also acceptable. Avoid direct application of extremely cold water or ice packs. Medical ice packs can be applied to the neck, underarms, and groin areas. Unconsciousness can be caused by any combination of injuries, exposures, emotional responses, allergic reactions, or other physiological conditions. By now, you as the first aid provider have called 911 and have determined whether CPR is required. Assuming the victim is breathing and their heart is beating and CPR is not administered, and depending on their physical state from any injury that may have occurred, they can be placed in what is called the recovery position until professional help arrives. Stay with the victim and continue to monitor them. If they regain consciousness, comfort them and reassure them that help is on the way. Fear of personal infection and injury may cause a person to hesitate when administering first aid. There definitely are risks involved. Victims may be disoriented enough to grow violent, or their unconscious reflexes may cause an injury to the first aid provider. Bloodborne pathogens, along with the risks from air and saliva exchange, should be mitigated as best as possible using appropriate barriers. There are also the risks run through exposure to what originally caused the illness or injury, such as chemicals, temperature extremes, electrical hazards, and so forth. Continued training and practice, coupled with the proper use of PPE during an emergency response event, will help minimize personal risk during first aid procedures. So, what do you do when you find yourself in a situation where first aid is called for, but you do not have the appropriate supplies? Much of what we have explored in this training still applies. Assess the situation and stay safe yourself in the process. Call in emergency medical personnel when the situation is serious, or if you are unsure of the severity of an injury or illness. Do not improvise tools or equipment. It is likely that you will do more harm than good treating someone with items that are poorly sanitized or not meant for that purpose. You will often still be able to find clean water and perhaps even clean unused cloth to help with sanitation, temporary relief, and with which to apply pressure to bleeding wounds. Simple concepts such as providing shelter and elevating wounds still apply. Never use a water source that may be contaminated or concoct treatments. If the injury is not life-threatening, but you cannot handle it, arrange for the victim to go to an urgent care facility or book a same-day appointment with their physician. In our world of liability and lawsuits, a person might hesitate to administer first aid for fear of being accused of negligence later. However, all states have some form of what is called the Good Samaritan Law. These laws protect non-medical personnel when treating victims in good faith, so long as they do not practice what a reasonably prudent person would consider gross negligence. Gross negligence occurs when someone willfully disregards the need to apply reasonable care to a scenario. This willful disregard for reasonable precautions and treatment would predictably lead to serious injury or harm. You should confirm the scope of your state, territory, or district's Good Samaritan law after completion of this training. As previously discussed, according to OSHA's current record-keeping rule, incidents requiring first aid do not need to be documented. However, this only includes minor first aid cases, not emergency aid that requires follow-up by a medical professional. These incidents must be reported. Regarding first aid kits, current legislation does not require specific quantities of items and kits, but the amount on hand should match the potential demand of the existing workforce. Over-the-counter medications that are not typical of a kit should not be administered without the direction of a medical professional. If safety equipment and supply cabinets are to be locked, they must still remain readily accessible. To assist with compliance on this point, multiple copies of the key should be distributed, and all personnel should know where to obtain a key within a very short time frame. When in doubt during a first aid situation, call for guidance and assistance from the local medical emergency response team. If not already in place, it is time to develop your workplace's first aid program. OSHA offers a best practices guide on the fundamentals of building workplace first aid programs. This guide can be referenced to help any organization start or strengthen their emergency response practices. In general, your workplace first aid program should include an assessment of illness or injury risks, preparation of and access to first aid supplies and equipment appropriate for responding to these risks, and ongoing training in first aid to employees. It is good practice to have designated first aid providers, but all workers should know how to administer first aid. This will help both in responding to accidents and also in the event of needing to receive on-the-job emergency treatment. First aid kits are typically equipped with treatment instructions, but digital step-by-step guides and resources are also available. Since smart devices are prevalent, they can be leveraged by employees to stay prepared with properly vetted first aid apps. A job hazard analysis, or JHA, is a formal way to approach risks in any workplace. JHAs allow workplaces to think through tasks with a "what could go wrong" approach. Develop your JHAs by interviewing workers who do the tasks every day and seek further training when needed. Put all of your policies in writing and build a system of open communication and documentation of task hazards. Personal protective equipment, or PPE, is used in many work environments. Always consider PPE to be a second-level defense against injury and illness. The best way to avoid needing to administer first aid is to build a culture of safe work practices, and the second line of defense is proper use of protective gear. Practice safety through regular discussions and by acting out and practicing first aid in fabricated scenarios. Just like the supplies in a first aid kit, knowledge sometimes expires. Keep your team's skills sharp. Depending on your work environment, it may be advisable to seek training on hazards you are likely to encounter related to very specific first aid needs, such as heat stress, bloodborne pathogens, and CPR and AED. No single training can prepare you for every situation or all categories where first aid might prove of benefit. Remember that the goals of first aid are to preserve life, prevent further injury or worsened illness, alleviate suffering, and to promote recovery. Preparation starts with familiarity with first aid supplies and equipment locations, along with proper application and response. When in doubt, call 911. Emergency response personnel will talk you through proper procedures or will direct you to the correct agency. Time is always of the essence. Your intervention may make all the difference.